This video is going to talk a little bit about abdominal regions and quadrants, and this is especially useful when we're talking about abdominal pain, to be able to describe pain in relation to an abdominal region or quadrant, but also it's useful just in terms of thinking about where organs lie in the abdomen. The abdomen is commonly divided up in two different ways, into quadrants and into regions. Using quadrants is pretty straightforward. All we have to do is draw a line down the midline from the xiphisternum to the pubis, and then across from one side to the other through the umbilicus. And this gives us a very simple right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. If we're going to divide the abdomen up into regions, then we need to divide it up into 9 separate zones. And we do this by drawing 2 vertical lines and 2 horizontal lines. The 2 vertical lines come down from the mid-clavicular region, right the way down, here, crossing through the inguinal ligament. And the 2 horizontal lines, we have one that is the subcostal line, and that goes underneath the costal cartilages here anteriorly, so that just goes across there. So that's the subcostal line. And we have another one, which is the transtubercular line, and that goes through the iliac tubercles. And the iliac tubercles are situated a little bit posterior from the anterior superior iliac spine. So the anterior superior iliac spine is here, and we go a little bit superior, rather posterior, and then we draw a horizontal line across here. And that divides this whole area up into 9 zones. So we name these zones the right hypochondrial and the left hypochondrial areas, and hypochondrial simply means below the cartilage. So if you think about them being below the anterior ribs there. We then have an area here called the right lumbar and left lumbar area. These used to be called the right flank and left flank, so you may hear that. If we come down a little bit, we have the right inguinal and left inguinal regions, also called the right iliac fossa and the left iliac fossa. And last but not least, we have these 3 midline zones. They're very important, and they are the epigastric area up here, epigastric, the umbilical around the umbilicus, and the suprapubic area there. It's very important to have an understanding of these areas, these zones that we've divided up here, especially when people are trying to describe pain or when people present with pain, then you can actually locate that into one of these zones, and that's very helpful for describing it.